So Rishi Sunak and Keir Starmer met across the dispatch box for the first time this year, yesterday. It was on a day when paramedics and 999 call handlers were striking. So that gives you a bit of a sense of what was going on in the real world outside Westminster. So the stakes were really high in this conversation. What do you think the dividing lines were that were being drawn out by the two leaders? Freddie, you were in the chamber.
Yes, I think that gave it a little bit more of a sense of urgency. There was a sense that was something that was at stake, and I think Starmer was trying his best to really hold the government to account on the NHS. One of the key things he did, which is quite new and I think it worked quite well this time, was actually try and directly compare the state of the NHS in 2010 to where it is now. I mean, they've also done this in the past 2 years, but that's always been quite tricky because we've had the COVID pandemic, so the government were able to point to that and blame the pandemic for the state of the NHS. But I think COVID is slightly receding in the political imagination now. So it opens up a bit of a gap for Starmer to make those comparisons and remind people what the NHS was like under Labour.
There was quite a lot of jeering and heckling from the Tory benches when Starmer tried, as it were, to put brackets around the COVID experience. You know, you can't put brackets around a pandemic. But there is no doubt, if you look at the numbers, that Labour has a strong point comparing the condition of the NHS, waiting times and so forth, and staffing, with when they left office and where we are now. And that has been a longer story than the pandemic, obviously. But no, I thought it was a very feisty exchange. As we saw at the latter part of 2022, Starmer was more self-confident, smiling, enjoying himself more, easing into the role, probably on the back of those polling numbers. And Sunak, as last year, was perhaps more aggressive, more political than we expected.
Yes, a bit more defensive. Yeah. And it was interesting because he did come clean-ish about his use of private healthcare in the past, something that he came a bit unstuck with over the weekend, refusing to answer the question about whether his family uses private healthcare. He said that he is registered with it. He called it an NHS GP, even though GPs aren't NHS, but had used independent healthcare in the past. Freddie, I mean, why did he feel the need to say that? Does it show his political naivety that he didn't just tell the truth in the first place? And how much do we actually know?
Yeah, I mean, we still don't know the full extent of what he's used and what he's used in the past. This originally comes from the interview with your Laura Kuenssberg back on Sunday, and he refused to answer the question 4 times. Kuenssberg made the good point of comparing it to Margaret Thatcher in the 1987 election, when she was very adamant and clear that she was happy to have private health insurance, and she explained why. I mean, the contrast was clear. And then the other thing I thought was interesting about that episode was the way he appealed to privacy was very similar to what he did last April, I think, when the debate over his wife's tax affairs became really clear. I mean, that again, and that didn't go very well, okay? So we knew that wasn't going to work. You're going to get journalists asking every single day, so does he have a private doctor? Does he have a private health provider? And eventually in PMQs right at the start, he tried to clarify it.
I think that's a really good point there, because in a sense, nobody is going to be surprised at all that a very, very wealthy man has a bit of private health insurance. I mean, that happens right across the board in this country. Labour politicians should be and are embarrassed if they're caught out with private health insurance. It's not the same for Tories. But I think the defensiveness, I think Freddie's absolutely right, is more about he feels and Labour feels that his private arrangements around his marriage and money and all of that are a potential line of attack for the opposition, and he is trying to build defensive walls before that happens. Now, this one came down very quickly.
Well, something that I thought was interesting, and it's just a small thing, but the person who asked that question was Cat Smith in a backbench question. Keir Starmer didn't ask him about it directly, and this is a little bit how they deal with the Prime Minister's extreme wealth as well. Keir Starmer and the Shadow Cabinet generally try and stay off it. Yeah, and is that a sign that Labour know that perhaps, like you say, Andrew, the public aren't going to be particularly surprised that someone who is so rich has private healthcare? And also, as we know, more and more ordinary people are turning to private healthcare with the state that the NHS is in.
Something going on underneath the surface that people don't talk about at the moment is the more headlines we get about the crumbling NHS, the collapse of the NHS, numbers of people dying in ambulances or in car parks or being left in corridors, the more quietly and privately around the country people are thinking, do you know what, I'm going to put a few £100 into private healthcare. I'm going to avoid the system entirely. Now, nobody wants to talk about this because they want to defend the NHS, and they don't want to acknowledge the big growth of private healthcare in Britain, but it's real. I mean, the big American companies are all opening private hospitals around London. Money is pouring into private health in this country, and I think that is part of the health story that's not being told properly.
Yes, it's true. And it's tricky for Starmer. I thought one of the blows that Sunak did manage to sort of land in PMQs yesterday was about this idea that Labour were discussing more outsourcing into the health service. Starmer having said that he was against that previously, Sunak picked up on that, and perhaps he knew that there might be a little bit of tension between what the Shadow Health Secretary, Wes Streeting's been coming out with, and the direction of some of the other individuals in the Shadow Cabinet.
Yeah, I mean, it's always a very tricky topic for Labour to broach. I think this comes from multiple things. Wes Streeting has said that he's, in principle, just generally open to the private sector and public sector working together, whether that's in health or elsewhere. Then we've also had the debate about whether he wants to bring GPs straight into the NHS rather than the current arrangement where the NHS basically pays GP practices to do what they do. So there's lots of different facets there. I think the problem is for Labour, they don't want to get bogged down in a debate about privatisation unless it's directed at the Tories. So I don't think they can make much headwind in this. I mean, maybe it'll come up in the future, and maybe they need to, maybe start. The Tories will have something. You got to remember back in, was it the 2019 or 20? I think it was the 2017 when it was 2019, and we had the big debate about the US trade deal.
Oh yes,
and Labour did quite well then. Corbyn did quite well. Remember, he stood up in the debate with those documents that he'd. That had been leaked to him, saying that the Tories want to sell the NHS to the Americans. That works really well. It doesn't work so well when you've got Labour Shadow Cabinet preaching the same things. Yeah,
what's going on with Streeting? Is he freelancing? Has his idea of himself as a sort of reforming health secretary in the future gone to his head a bit?
I think it's really worth us talking about Wes Streeting a little bit, because he is the most interesting outrider by far on the Labour front bench at the moment. And, he has been given licence to go further than anybody else, given licence to, as it were, say things that are unpopular in the NHS on the front page of the Daily Telegraph. But where he has to be careful is, as it were, spending virtual money that has not been signed off by the Labour Treasury team, because they're trying to be very disciplined about that. I think that he came up with some really interesting thoughts about reform in the NHS over the past week. I thought that, in particular, this idea of a great expansion of primary healthcare centres, where you've got doctors and nurses and physiotherapists and chemists all working out of the same building. That was part of the original promise and premise of the NHS back in the 1940s. And although there are places like that around the country, there aren't that many, and it hasn't happened. I think it would be a very, very interesting way of trying to get people into basic diagnosis, basic sort of triage care, without them having to go into A&E and take the pressure off the big hospitals where the pressure is most intense. So I thought it was really, really interesting. But it's an expensive policy. Opening all of those centres, moving people into them and hiring the right number of staff would be an expensive policy. And we haven't heard from Wes Streeting or from Labour yet how they'd pay for it.
I think this is one of the big problems with discussing Labour policy at the moment, is that we're getting dribs and drabs week after week, which sort of signal what they want to do and sorts of signals their priorities, but we don't yet have that comprehensive plan about how they want to go about public sector reform, for instance, how they want to try and address some of the more fundamental perennial problems within the NHS, because in part they have to decide how much money they have to do those things. So we're still in this sort of limbo at the moment where the Treasury team needs to work out, okay, are we going to raise taxes? Are we going to, stick to the Tory spending plans, whatever we're going to do? And that bleeds through into every other policy issue that we have. So we're sort of in a bind at the moment where we're trying to point at where Labour want to go, but we can't have a comprehensive debate about it.
Absolutely. And at the moment, all of this is seen through the prism of staffing costs and the industrial action and the strikes, which means that other health policies, which are inherently interesting, for instance, Wes Streeting's suggestion that we could become a completely tobacco-free nation and that there should be really strict limits on vaping. I think very provocative policies, perhaps not popular ones, I don't know, but really interesting. That's been sort of put to one side. Nobody talks about it because we're so focused on the money and the staffing costs.
Yeah, it sort of reminds me of Sunak's policy to ban single-use cutlery at the moment. Maybe not the key issue that the nation are crying for a policy on.